Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to be doing an educational video, much like the one that we also posted today, about different types of tooth movements and what it looks like. And today we're going to be talking specifically in this video about crowding. And maybe you are a patient, maybe you're a consumer, maybe you've been to the dentist, the orthodontist, and they've talked to you about different ways if you have crowding. So let's talk about the pros and cons and what these different movements look like. So crowding is most often a result of having incompletely grown jaws, jaws that didn't grow the right width, or jaws that didn't grow forward enough on the base of your skull. And this is the result of either not breastfeeding long enough as a baby, having a soft or processed diet in tribal cultures or in cultures, primitive cultures, even now. And there's been many studies that have gone back hundreds, if not thousands of years that are seeing this, where people who have more primitive diets, they go from exclusively breastfeeding for 1 to 2 years as a baby to eating hard and crunchy foods, meat, ripping the meat off the bone. No, they don't have, knife and fork. They're chewing, they're grinding. They have a very abrasive diet with a lot of sand and dirt in it. And that actually helps the jaws grow wider and more forward. It gives you a better airway. It also helps you not have crowding. And most of these cultures, there is no crowding. It's really primarily a first world problem that every generation it's finding it's getting worse and worse and worse, as well as our airways are getting smaller. So anyways, that's just a little bit of science for you. But what are we going to do about it, right? You already have crowding. Now we got to fix it. Okay. So not that hard to fix. Okay. Different ways to fix it. So let's talk about the more natural ways, which would be either expanding an arch, okay, like this. The more you expand an arch, the crowding goes away, okay? Now we have some spacing. Or you can also grow a jaw. You have to do that, obviously, with jaw surgery if the child isn't growing anymore, if it's an adult, okay? Or you can extract teeth. Probably should have done that one last. Or you can do something called interproximal reduction, which means just sawing in between the teeth a little bit to eliminate the some of the width, just a teeny bit, a sliver. That actually works very similar to how having a sandy or abrasive diet would work. When you chew, the sand gets in between your teeth and wears it down. Very similar, very natural. Or you can tip the teeth forward on the jawbone a little bit. Or you can distalize or move the teeth backwards. That actually makes your airway a little smaller. So it's not really my first choice, but in some people that does work, okay? Either way, that's going to give us no crowding, hopefully the space we need to line all the teeth up nicely. And that's pretty much your options for crowding there. Obviously, things you have to think about, limitations, right? Growing jaws, the only way you're going to grow a jaw is if there's a still growing child before they finish puberty, or an adult with jaw surgery, right? So that might be off the table if you're 20 or something, unless you have 50 grand for jaw surgery. What else? Distalization, scooting things backwards, we can do that, but not if there's impacted wisdom teeth or even erupted wisdom teeth, because you don't have room on the jawbone for that. So that worked well if you had your wisdom teeth extracted. That's an option. Moving teeth forward or tipping them out, or proclination. You see that most common in aligners or braces, but that only works, depending on your jawbone. So if your bone isn't thick enough here, let's say for example, you have okay, we're doing we're totally ruining this. Let's say we have no bone anterior or forward to these teeth. If we try to tip them forward, what's going to happen? Well, the roots are going to come outside the bone, and that tooth is going to devitalize, and it's going to die and or get loose and fall out. So you can't do that necessarily in all patients. You have to measure the bone. You can measure it clinically by examining a patient in person. You can measure it radiographically, by taking a cone beam CT scan. Sometimes I can kind of see it in a Ceph x-ray, which is sometimes why we take those x-rays for orthodontics. Sometimes you can see it in pictures too. So that's another way as well. But that is how about proclination. We talked about distalization. Obviously, extraction, not my first preference. I don't want to kill teeth. Pull them out. That's the bottom of the list. IPR or slenderization. Nice, that's a good option as long as you don't have like crowns or veneers or interproximal fillings. That's probably not going to work. It's only going to work on natural teeth. Yeah, and definitely widening of the jaw. You can get some widening a little bit just with arch wires and aligners, but like I said, there's a limitation to the bone. In a child who hasn't finished puberty, the upper jaw can be split with a palatal expander. We are actually literally breaking the jaw, okay? They don't feel anything, they really don't. Because they're sutures, it's like almost like a baby. They're still very spongy, and it's a very gradual process. So they don't notice that you're breaking it, but you are breaking it. And you're expanding it, and then the lower arch will kind of develop to match. Sometimes we expand the lower just to get typic. But in adults, it's a jaw surgery for the most part, either with implants that are drilled in the jaw, or they actually go in and cut the jaw. There are a lot of risks for that. Any of these type of quote unquote adult expanders, it's not something that is for the faint of heart. I would only do it with an oral surgeon and an orthodontist who are very experienced with these surgeries or appliances, because there is a lot of side effects that can happen, a lot, and I've seen them. From hemorrhage to death, devitalization of teeth and nerves, facial numbness. So I think you have to be it's considered a very serious type of procedure if you're going to do that. It isn't someone that I might get a lot of hate emails from this, but I wouldn't just do it with your local dentist. It's not a great idea. So, to be honest, I've only done a few of these surgeries in my lifetime, with oral surgeons. I don't do the surgery, but I've assisted on the surgery, and I've had patients that had them. It is a rough procedure, but it turns out great. It turns out great. So, all right, hopefully that was helpful. Thank you so much for listening today.